That's
But
what is
PCOS is a
cluster
of entities.
Right.
Where
There are so many women who come to us and they will say that I don't know, my periods are regular, I have not gained weight.
Telling the parents that okay, now this is the age of a girl where you have to do these things, you have
Right.
to avoid certain things, you have to make her walk or do swimming or dance or whatever.
Right.
You have to do that. Will that not be much more beneficial than putting the patient on any hormonal tablet?
Definitely. Welcome to PCOD Heal Naturally. Polycystic ovarian disorder, a very common problem which most of the women faces, and it's a very big challenge to understand PCOD and how to combat with the changes, the symptoms, and how to reverse PCOD is very difficult. In today's episode, where we actually have with us a renowned gynecologist, Dr. Hemant Brahme, 30 years of experience, and will guide us through this journey, how PCOD comes and how we can actually understand what is PCOD. So welcome, Dr. Hemant Brahme, and you will have to guide us in how PCOD occurs in a woman and how can we really get the symptoms of PCOD. That is very important for all of us.
Sure. Thank you very much, Dr. Yogita, for having me here. And before we start the show, let me have a disclosure. This is not an advertisement or anything. This is just the educational purpose. Now, as far as your question of PCOD is concerned, you need to understand the menstrual cycle physiology. Now, in the menstrual cycle, what happens is that once the woman gets menses, after that, the process of egg formation starts. It starts from the center of the ovary. It is a small in size egg, which gradually grows in size and reaches up to periphery of the ovary. Normally on 14th day, and sometimes in relation with the next menses, it gets ruptured and comes out. In PCOD, this rupturing process of the egg does not take place. Okay. That is the reason why that egg remains at the periphery in the form of a fluid-filled cyst. Okay. This way, the one cycle goes off. Ovary is there to continuously try and attempt egg formation, which is going to get released. So next cycle, again, it will start process of formation of the egg with the hope that it will rupture. Okay. Again, it comes up to the periphery, but if it is not getting ruptured, it remains there at the periphery. This way, the multiple cycles of anovulation, which is failure to rupture of the egg, forms a signet-ring appearance on sonography, where we see at the periphery, there are multiple cyst-like things on the periphery of the ovary. This is a typical PCOD.
And we would like to know what is the difference between PCOD and PCOS.
Now, as you can understand, PCOD is the polycystic ovarian disease. Right. And PCOS is polycystic ovarian syndrome. Now, disease means a singular entity. Okay. When you have a woman or a girl who is, say, 20, 22, and she has got irregular menses, and she has no other symptoms, but she comes to you only because of irregularity of menses, you do sonography, and you find this signet ring appearance in the ovary, you may call it as a PCOD, which is a singular entity. Okay. However, if suppose this PCOD is associated with other symptoms and signs and diseases, like, for example, obesity, okay, hirsutism, that is male distribution of hair. Woman also has got some diabetes mellitus. Okay. Woman also has got hypertension. Okay. Then that syndrome of symptoms or signs or entities is called as a PCOS, okay, which is polycystic ovarian syndrome, where you have to address not only PCOD, okay, but all other things.
Underlying.
So in short, if I have to tell you, PCOD can be a part of PCOS.
Right. That's
but
what
PCOS is a
cluster
of entities, right, where it cannot be separated from PCOD.
Right. But is it that these symptoms are overlooked by people or by a woman. And there are so many women who come to us and they will say that I don't know, my periods are regular, I have not gained weight, I don't have even hair, but still that patient is PCOD. So is it that only when they irregular menses are there or they gain weight, then only they are PCOD, or every woman has to be careful? Certain points must be there that they have to be careful and then they should look out for the symptoms or the symptoms of PCOD.
Right. Now, see, the most common symptom of PCOD, at least in early age of a woman, is irregularity of menses.
Okay.
And for understanding this, again, you need to understand menstrual physiology.
Okay.
Why does menses come after every 28 days or 30 days of irregularity?
Right.
Because after ovulation,
Within 14 days, a woman will give away the endometrial support which she has developed, and that's why the menses will start. This happens only after ovulation.
Okay.
What did we say? We say that in PCOD, the ovulation is erratic or it may not be there.
Okay.
And because it is not there, it keeps on forming the cyst and hampers the function of ovary.
Okay.
And because of which the menstruation which has to happen after 14 days of ovulation will not take place, and she will present to you with irregularity of menses. So to assume that somebody who has got no other signs and symptoms, like you said, obesity, hirsutism, lethargy, excessive maybe hypertension, and at the same time she is getting her menses also regular and normal, then it will be little bit extended to think that she has got PCOD.
Okay. And is it certain age only this PCOD starts, or is it that at the beginning of PCOD also we have this, that they have irregular cycles? Like there are young girls who are at the beginning of the menstrual cycle, they will get periods today, and after again 45 days, then after 2 months, there is no regularity. But you see that they are gaining little weight. So should we wait, or should we start addressing them as PCOD, or should they go for a checkup, or they should meet a gynecologist? Is very important, because most of them think it's just the beginning and that is overlooked, and it goes up to 6 months to a year. By that time, they start developing some cyst or some irregular periods, because I've seen young girls of 11 to 14 years also suffering from PCOD with high insulin levels also.
absolutely nice question. Because you have to see that now women are getting menses. Previously, menarche, that is the first menses of women,
Used to be at the age of 13, 14.
Right.
Now it is shifting towards 11,
Yes.
sometimes even 10. Whenever a girl starts with her menses proper, one expects that initially, maybe till the age of 17 to 18, when a girl used to get menses at the age of 13, 14, we used to say that till the age of 17, 18. So if at all the girl is getting menses, first menses at the age of 11, I would say by the age of 15 to 16. We should give the body some time to adjust to this new pattern which she is experiencing, a girl is experiencing.
Okay.
So immediately, if suppose you find that a girl has got her first menses at the age of 11, next 3 months she doesn't get her periods, she gets her periods again, which lasts for 7 days, 10 days. Again, it stops on its own. And then again, she doesn't get her period for 6 months to 8 months. This way, this irregularity, zigzag pattern continues till the age of 15. I would not immediately label her with PCOD. Because I would accept it as the body adjustment towards the new change in her life.
But what if she starts putting on weight?
Correct.
She has
I'm
more
coming to that.
belly fat.
Absolutely correct. So what is required? Now we are staying in a mega city, metro city. We have all possible investigations. There comes the role of investigations.
Okay.
And the most simple, non-invasive investigation which one can do is the sonography.
The sonography.
Yeah. If at all you do sonography, and if you find that there is element of PCOD, which is of severe variety, and as you said, she also is developing the symptoms like obesity and everything, hirsutism, everything, then yes, then you may have to even intervene at the early age. You being a dietitian, will it not be better if suppose whomever you see, maybe a woman who has got a daughter of 11 years, 10 years, you start guiding them as far as your consciousness towards diet.
Yes. That's
from 11 to also. And if suppose they are absolutely conscious about their lifestyle, their diet, their exercise, then there is very, very little chance that a girl would require any medicines at that level. My short point is that I generally do not like to put a girl of 11 or 15 on any hormonal medicine.
medicines.
Correct.
Right.
So for that matter, people like you, if suppose they start doing some education and telling the parents that, okay, now this is the age of a girl where you have to do these things, you have to
Right.
avoid certain things, you have to make her walk or do swimming or dance or whatever.
Right.
You have to do that. Will that not be much more beneficial than putting the patient on any hormonal tablet?
Definitely. That's what this PCOD Heal Naturally we have started here, because want to bring that awareness that
Correct.
we don't have to wait for the PCOD symptoms or till the girl or a lady suffers from PCOD. The moment the children start putting on weight, and you feel especially on the midriff, as far as my knowledge is that they start putting on the midriff and everything goes wrong, and that's usually post puberty, especially among girls.
Very true.
And then they really become lazy, they become little how do I say, anxious, they're conscious about their looks, they want to rebel the
Yes.
moment you tell them diet. So it's like we have to deal with it in a very matured way. That's what I feel. It's not like you have to tell them this is what it is, but guide them through the journey along with their so much of stress of education and competition which is going on in their life.
Very true. I always use this one line, catch them young.
I agree with that.
If you catch them young, you will be able to control everything at a proper time.
One more question I had is because wherever I've seen, they feel okay, hormonal tablets they take or the contraceptive pills they take for 21 days, and they're very comfortable and they are living for 6 months, 1 year, 3 years, 4 years. Recently, some girl was like, from 18 years I've been taking it and I'm 32 and I'm on contraceptive pills, so I'm off PCOD. Is that the right way of handling it, or is that the only solution for it?
So, to understand whether you want to give OC pills or whether you want to avoid OC pills, you have to understand that there are two ways how you can treat PCOD. One is that you give rest to the ovary completely, and second is that provide energy to the ovary from external source, which is by giving ovarian tonics, as I call them. Now, if at all suppose the PCOD is of this little bit severe variety, even in early age, then this role of contraceptive pills works. But definitely it should not be taken for such a long time, as you said, till the age of 32 continuously. Definitely not.
Thank you, Dr. Brahme. It was a great insight for us, understanding PCOD, how it comes, from where it comes, and how to manage PCOD. It was great to understand PCOD. We know the symptoms, we know the protocol of how it happens, why it happens, and you've cleared out a lot of myths and giving us the scientific background. It was a great pleasure. Thank you for coming.
Thank you very much. Pleasure is all mine. Thank you.
Thank you.